Hey guys, welcome back to my channel, and today I'm going to be starting a series of lectures, and the first topic that we're going to discuss would be oral pathology. And today in this video I'm going to be discussing developmental anomalies of teeth. Okay, so talking about contents, first I'm going to give you guys a gist about the physiology, and then I'm going to be talking about all pathologies. So talking about development of tooth, the first initiation of a tooth development begins at 6th week of intrauterine life. So seeing this histology diagram, the structures that are seen are the structure that is marked as A is called as the dental lamina, which eventually develops as enamel. Okay, so the structure seen as B, marked as B, is called dental papilla. So this develops into dentin and pulp. So structure C is the dental follicular sac, which develops into cementum, periodontal ligament, and alveolar bone. Okay, I'm just mentioning these to you guys from the exam point of view, just the important points. Okay, this topic is in toto very vast topic, which I'm going to be discussing on the later stage. Okay, so as I mentioned, these dental lamina forms enamel, right? So after it forms enamel, these cells disintegrates and remnants are seen. So these are called as epithelial cell rest of serous. So the cells that form ameloblast is enamel. Sorry, the cells that form enamel is called as ameloblast. The cells that form dentin is called as odontoblast. And the root is formed by something called as Hertwig's epithelial root sheath. So just like dental lamina, after it forms root, these cells disintegrate and form something called as epithelial cell rest of Malices. So do not get confused. Dental lamina forms cell rest of serous, and Hertwig's epithelial root sheath forms cell rest of Malices. Okay, you should know to differentiate these two. Alright, so in this video, like I mentioned, I'm going to be discussing about developmental abnormalities of teeth based on number, size, shape, structure, and some of the miscellaneous developmental abnormalities. Okay, the first one is number. So hypodontia, anything that is above normal is called as hyper. Okay, so hypodontia means extra number of teeth. So extra number of teeth are called as supernumerary teeth, and the most common examples of supernumerary teeth are mesiodens and paramolar. So mesiodens is found between two maxillary central incisors. Okay, so this exact picture which is shown here is a mesiodens. Okay, so this mesiodens, so anything that you learn in pathology, you need to know why it occurs and what does it do and treatment. So why it occurs, extra number of teeth, genetically formed, and treatment is, since it is not aesthetically pleasing, extraction is a recommended treatment. So in a radiograph, supernumerary teeth can be seen like these, extra number of teeth. Okay, so they might give you a picture or a radiograph which has extra number of teeth and tell you to identify what it is. Okay, so paramolar is another example for the supernumerary teeth, which is found distally to third molar or palatally to third molar or lingually to third molar. Okay, they are very, very tiny shaped molars that are supernumerary teeth found close to third molars. Okay, so these kind of supernumerary teeth are most commonly associated with a syndrome called Gorlin-Gord syndrome. This is another important MCQ. Gorlin-Gord syndrome, keep that in your mind, guys. Okay, hypodontia. Now hypo means anything less than normal. So first type of hypodontia is anodontia, which means completely missing teeth. Okay, there is no teeth at all. So this is seen in a condition called as hereditary ectodermal dysplasia. So this condition, ectodermal dysplasia means anything that is, any structure that is arrived from ectoderm has defect. So enamel is derived from ectoderm. So no teeth at all. Okay. So this is a classic picture of hereditary ectodermal dysplasia where hair is less, skin is very dry and very lifeless, and maxillary retrognathism, mandibular prognathism, and the patient tends to look old, and complete anodontia, which means complete missing of teeth. Next, hypodontia, one or two missing teeth. Okay, so this is most commonly seen. People have congenitally missing third molars and second premolars, maxillary lateral incisors. So maxilla is more commonly involved than mandible. Okay, oligodontia means 6 or more teeth missing. Okay, so the treatment for all these condition is lesser number of teeth is you can replace those missing teeth with dentures or bridges or implants depending upon the number of missing teeth. Okay. Okay. Next is size of teeth. Microdontia means small size teeth. Complete example for this microdontia is peg lateral. Okay, maxillary lateral incisors have most commonly associated with microdontia, and they are called as peg laterals. And my complete microdontia of all the teeth is seen in pituitary dwarfism, okay, where growth hormone is suppressed. And macrodontia means teeth which are bigger than normal. So these are seen in pituitary gigantism, where growth hormone is in excess. Okay. So for these microdontic teeth, you can do crowns, which will improve aesthetically. And for macrodontia, regularly no treatment is recommended. Okay, moving on to the shape of the teeth. Okay, in this you have something called as gemination, which means if you see this picture, a single tooth bud is split into two. Okay, it's not completely split into two. If it is completely split into two, it's called as twining. Okay, a single tooth bud is split into two in the crown surface alone, so that's called as gemination. If it is split completely into two, it's called as twining. However, this term is not generally accepted. It's usually called as supernumerary teeth. Okay, so fusion means two teeth are fused together completely in the crown and root surface, or any of the surfaces. Okay, so the main question that these people ask is in gemination, the tooth number is not at all reduced because a single tooth split only into two crowns. Okay, in fusion, the tooth number is reduced because two teeth are fused into one. Okay, concrescence means the two teeth are fused through cementum alone. Okay. Okay, so this is a classic picture for gemination where a single tooth bud is split into two. Okay, you can see the split in the crowns. Radiographically, if you see, this is the exact picture where a single tooth is split into two crowns. Okay, whereas in fusion, you have two teeth that are fused together to form one teeth. Okay, so this is a classic picture for a fusion where two teeth are fused together to form one teeth. Okay, like I mentioned, concrescence means two teeth are fused together in cementum level alone. Okay, only in cementum means it's called concrescence. So cusp of Carabelli. Okay, so this is not an anomaly in general. You will find this fifth cusp in maxillary first molar. All right. So the next one would be Talon's cusp. So this is an accessory lingual cusp seen on the maxillary anteriors. Okay. So the most common MCQ that they ask you here would be what syndromes they are associated with. So supernumerary teeth, earlier I mentioned it's associated with Gorlin-Gott syndrome. So this Talon's cusp is associated with Sturge-Weber angiomatosis and Rubinson-Taybi syndrome. Okay, please keep that in your mind. Okay, Next, moving on to dens evaginatus, which means an extra cusp is seen on the tooth. An extra projection is seen on any tooth. Okay, so this is also called as occlusal tubercle or extra cusp. Mostly this is seen on premolars. Okay, if these dens evaginatus is seen on incisor, they are called as shovel shaped incisors. Okay, this is another important MCQ that you get in exams. And dens invaginatus means an invagination is found in a tooth, which means tooth within a tooth or dens in dentin. So this picture shows exactly the invagination. This is at the coronal level, this goes till the root, and this goes till most 3/4 of the root. Next, moving on to taurodontism. Taurodontism means the pulp chamber is enlarged. The body and the pulp chamber is enlarged in a multi-rooted teeth. Okay, these are the stages of taurodontism. Normal, mild, this is normal. Okay, mild, moderate, and severe. So another important point that they ask you in exam is what are the syndromes associated with taurodontism. So these are the listed syndromes that are associated with taurodontism. Amongst these, the very important ones are Down syndrome, amelogenesis imperfecta, and clean filter syndrome. So these are very, very important. They might ask these three syndromes associated with taurodontism. Okay. So in Inbde sample questions, this was one of the questions. Okay, let's try to answer this question. So the question is, each of the following is true of taurodontism except one. Which one is the exception? A. Large pulp chamber due to occlusally displaced furcation. Okay. B. Occurs in patient with amelogenesis imperfecta and Down syndrome. I did mention this point to you guys that it is associated with amelogenesis imperfecta and Down syndrome. This primary and permanent teeth may be affected. Yes, both the dentitions are affected. Unusual root shape due to late invagination of Hertwig's epithelial root sheath. Yes, unusual root shape is seen due to the invagination of it. So A is the answer. Why? Because large pulp chamber. Yes, they have large pulp chamber, but due to occlusally displaced furcation, this furcation is displaced towards the bone, not towards occlusally. So A is the answer for this question. Okay. Alright, so moving on to next anomaly, hypercementosis, which means excessive production of cementum. So this picture clearly indicates that too much production of cementum is seen. So this type of condition is usually seen in Paget's disease, acromegaly, and gigantism. Okay, this is another important MCQ as hypercementosis is associated with Paget's disease. Okay, so if you ask treatment for all of these, unless they provide any symptoms or anything, you don't need any treatment. If they have any sensitivity or any pain associated with that tooth, only then you get to do the treatment. Else you don't have to do any treatment for any of those conditions. Next, moving on to dilaceration. An angle or bend in the root is called as dilaceration. Okay, when it comes to treatment point of view, if you have an angle like this, it is difficult for extraction. You will have breakage of the root, so you'll have to remove the tooth surgically. So that is only the difficulty in dilaceration. Moving on to structure of the teeth. Okay, so the first thing is amelogenesis imperfecta. Like I mentioned, ameloblasts are the cells that forms enamel. Okay, so this ameloblast has certain stages of formation of enamel. Okay, so this condition can be X-linked or autosomal recessive. This is very, very important. All other abnormalities related with structure of teeth are autosomal dominant only. Okay, but this condition is associated with X-linked or autosomal recessive. This is the only condition which is associated with all three. Others are all autosomal dominant. Okay, so this amelogenesis imperfecta is classified into three types: hypoplastic, hypomaturation, and hypocalcified. They are most commonly known as snow-capped teeth. So this is the perfect classification for an amelogenesis imperfecta. You don't have to know complete classification of all these things, but I would recommend at least you should know hypoplastic, hypomaturation, and hypocalcified types, and it is called a snow-capped teeth. Okay, so these are the pictures showing amelogenesis imperfecta. So in the first picture you have pitting of enamel and generalized pitting of enamel, and this is classic example of snow-capped teeth. Okay, and another common, so when you describe an amelogenesis imperfecta, they indefinitely have anterior open bite. Okay, so for all these types of classification, hypoplastic, hypomaturative, or hypocalcified, they tend to have sensitivity. So adequately, the recommended treatment is full coverage restorations. Okay, moving on to dentinogenesis imperfecta. Like I mentioned, only amelogenesis imperfecta is X-linked or autosomal recessive or autosomal dominant, but dentinogenesis imperfecta is only autosomal dominant. Okay, so this is also called as shell teeth or opalescent dentin or cap de Pons teeth. Amelogenesis imperfecta is called as snow-capped teeth. Okay, so dentinogenesis imperfecta is called as shell teeth, opalescent dentin, and cap de Pons teeth. So when these dentinogenesis imperfecta is associated with osteogenesis imperfecta, it's called as blue sclera. They have blue sclera. Okay, when it is associated with osteogenesis imperfecta, this is another important MCQ. Okay, so you get to see these transparent type of dentin here, and in radiographs the dentin is completely obliterated. Okay, you don't get to see any calcified structures due to the defect in dentin. Moving on to dentin dysplasia. So this is also autosomal dominant. There are two types in dentin dysplasia. Okay, the type 1 affects the root, type 2 affects the crown. So when it affects the root, you have short roots. This radiograph is example for the radicular type, where you have short root and obliterated pulp. You don't get to see the pulp chambers. Whereas when you compare the crown type, the pulp chambers are enlarged and they have a thistle tube shaped appearance. Okay, so this is another important MCQ between the radicular and coronal. Radicular has short roots and pulp is obliterated, but coronal has enlarged pulp and the pulp chamber is called as thistle tube shaped chamber. Regional odontodysplasia is when there is defect in all three structures: dentin, enamel, and pulp. So these teeth are called as ghost teeth. Okay, so here you have short roots and enlarged pulp chambers. Basically the radiographs looks like ghost. Okay, so these can be the examples of regional odontodysplasia. Alright, talking about miscellaneous stuffs. Some other developmental deformities that is very important when it comes to exam point of view. The first one is Turner's dysplasia, which means this type of condition occurs when a deciduous teeth which has periapical infection that spreads the infection to the permanent teeth. Okay, only one particular tooth is involved, whichever tooth has periapical infection. So these are most commonly seen in maxillary central incisors and all types of premolars. Okay, this is another important MCQ where periapical infection from deciduous teeth can be spread into a permanent teeth. Adequate treatment would be root canal treatment and full coverage restoration. Okay, in congenital syphilis, you need to know you have notch-shaped incisors which are called as Hutchinson's incisors, and molars, they're called as mulberry molars. Okay, these are very important. These don't need any treatment until unless they have any symptoms. Okay, talking about staining, so you have extrinsic and intrinsic. Extrinsic occurs outside the teeth, and intrinsic occurs inside the teeth. Okay, so you need to know these colors and due to what infection or due to what material these colors have come. Okay, so I'm leaving it to you guys for your reference. Extrinsic, intrinsic. Okay, please go through this and just have it in your mind vaguely, so that if you get any questions regarding these staining, you guys should be able to answer. Okay, so like I mentioned, you need to know the physiology in order to answer the pathology questions, and you need to know how to answer the treatment as well. So that is exactly where this exam needs you to be trained. Okay, you need to know what it is and you need to know how to treat the condition. I hope I have explained all of these things to you. If you guys have any questions or concerns, please leave a comment below and I will get back to you as soon as possible. And please subscribe to my channel to get the latest updates on my videos. And good luck to you guys. See you back with another topic. Thank you. Bye bye.